Hello, this is Adrian Penrose from the Medical Research Council. Welcome to this session by the Journal of Communication in Healthcare on increasing publications from developing nations. We have over 90 people with us today, which is fantastic. And can I first of all ask all of you joining in today to send us questions. There is a question section on your webinar sidebar there, so please send questions as we're going along and we'll try and answer as many of those as we can. So I'm going to introduce our three speakers today. We're very honoured to have each of them. So first of all, we're going to have Dr. Gaia Gamawaga. Currently, Gama leads the World Health Organization's work on communications capacity building for countries across the world. Gaia has worked for the World Health Organization for 15 years in several key roles, including capacity building for emergency response and emergency risk communications in disease outbreaks, health emergencies, and humanitarian crises. Now, Gaia has completed 50 missions, including national and institutional capacity building in nearly 50 countries around the world. She's a former journalist and a medical doctor by training, and practiced medicine before making the move to public health 20 years ago. Gaia also has a master's degree in international policy making and negotiation. And Gaia is from Sri Lanka, but has lived for over 10 years in each of the UK, China, and Switzerland. Then we're going to have Dr. Renata Chavo, who is editor-in-chief of the journal. Renata is a global healthcare and social innovation specialist with over 20 years of experience in a variety of settings, including the United States and several countries in Europe, Latin America, and Africa. Renata is also founding president of the not-for-profit Health Equity Initiative, senior lecturer at Columbia University, Mailman School of Public Health in New York City, founder and principal of a global expert consultancy, Strategic Communication Resources, and eminent author and research writer. And Renata was recently recognized as one of 300 women leaders in global health by an initiative of the Graduate Institute of International Development Studies in Geneva. And then finally, we're delighted to have Dr. Neil Squires, who is chair of the UK Faculty of Public Health International Committee. He is chair of the Academy of Medical Royal College's Global Health Group, and formerly head of Profession for Health and the UK Department for International Development, and is currently Deputy Director for Workforce at Public Health England. Neil has spent many years working internationally, living and working in Mozambique, Bangladesh, Malawi, and India, and doing work in a number of other countries. And this experience has helped build his understanding of the importance of building research capacity globally, and he will reflect on how this is prioritized by a number of different ages. Okay, Renata, would you like to kick off for us?
Okay, great. So before I start, I want to thank Adrian for the introduction and all of the colleagues from Money Publishing for their help and support with this webinar, and most important, our editorial board whose work is essential to the work we do at the Journal of Communication in Healthcare. I also want to thank our very esteemed panelists, both Gaia for being immediately receptive about the importance of this initiative, and Neil for his participation. It's a great honor to have both of them being part of this webinar. I want to start by providing a quick look at the global scientific authorship landscape. As many of you may know, the US, Canada, and a few European countries, which are listed here, account for 51% of all publications. This is changing. Other nations are on the rise, but they're still lagging behind. These are some statistics that are not comparable because they come from different studies, and some of them refer to global publication authorship, which is basically related to journals that have a space on the global space, while others refer to world scholarly input, which may be be also referring to local publications that are published in native languages. But in 2011, the developing nations account for approximately 40% of the world's scholarly input. And China is really responsible for most of this increase as they doubled their scholarly input in the last decade. However, most of the papers from developing nations are still in the physical sciences, and only approximately 18% and 53% are in other disciplines like health sciences or social sciences that are disciplines that contribute to health communication. The good news are that there is an increased scientific standing of many new leaders in nations. We have seen that in addition to the usual suspects, South Korea, Brazil, Turkey, and Singapore, Thailand have experienced an increase in the number of the publications that they produce, and also there is an growing international collaboration in reference to authorship. Why this matter? We live in a very complex and intersecting world, and we need a global approach to global and intersecting issues like maternal and child health, obesity, food system, immunization, and many of the other health and social topics in which many of us work. We also need increased collaboration so we can take advantage of shared solution of experience from other countries, and we know also from the recent Ebola crisis how important it is to build country-specific knowledge and systems in global health. There are a lot of great experiences from developing countries, but many of them remain underreported and underdocumented, and there are many barriers to publication. In developing countries, there are many conflicting priorities. There may be language differences. There may be limited interest or sense of priority in publications. There is limited funding or capacity. These are all key issues. But we also feel that scientific exchange should not leave anyone behind. It's very important to capacity building. It's important to workshop development. It ultimately is a right of all of these authors and practitioners who work in different countries. And we feel that it's also key to advancing our field, the field of health communication. I wanted to, put the perk there for the field of health communication, which is an exciting and ever-growing field. And there are some advances that have contributed to the advancement of health communications in the last few decades. Number one is our renewed emphasis on a people-centered approach to intervention design, in which communities, patients, and others, they really effectively work in the planning, implementation, and evaluation of our intervention. There are a number of integrated planning frameworks that have revitalized the field: communication for behavioral impact, communication for development, and social and behavioral communication that have been applied across different countries and revitalized the field. The advent of media and technology has made possible things that before were not possible to communicators. We also have a stronger emphasis. We understand that the ultimate results of health communication intervention is changing this behavior, is changing this social norm, is changing the social dynamics that may improve health outcomes. We also have always infused in our communication a social innovation-driven perspective. We have been, innovators in communication, and this is a very big landmark of the field. And finally, in the last decades, communicators have found themselves joining the health equity and social determinants of health movement and being able to address health and social issues within the context of the many social, economic, and environmental factors that determines them. So why basically increasing publication from developing countries? First of all, some of this is already happening. We have in some certain fields, and these are just a few examples, already communication planning frameworks that have been implemented across countries. We have examples like, for example, in the interpersonal communication and community-based field, the role of community health workers-driven intervention, which has been implemented in developing nations for decades, more recently is also implemented in the United States as a way to actually address health system-related gaps or increase cultural competence of key intervention. And the use of mobile technology is being used both in avian flu to communicate with poultry farmers, as well as in developing nations for things going from a tobacco cessation program to maternal and child health. So some of this is already happening. It's just not enough. So why is our journal interested? We are global in our scope. We are interested in innovative approaches, and so we're interested in innovation, and we know a lot of this innovation comes from developing nations. We want to explore models and planning framework that integrate different communication, intervention, and media, and we want to explore what is the role of different groups, the patient, the providers, the community members, and other key stakeholders in engaging and influencing health communication programs. We are sort of unique also because we are a multi-sectoral community that works across healthcare, public health, global health, development. If you do look at the list of our editorial board or the list of our peer reviewers, we really are an eclectic and multi-sectoral community. And we want to make a difference, and we get the importance of fostering scientific change across fields and country settings. And also we see ourselves as contributing to global debates on these topics. We don't think that our role should be only publishing articles, but we want to create a community around the field of health communication. So we are truly international. This is a glance of our editorial board and authors, and this is just a very partial view because our community of more than 163 peer reviewers represent even more countries than the ones that are on this slide. But as you can see, our editorial board has representatives from South Africa, Rwanda, Brazil, United States, Kingdom, and so are our authors represent many different countries. So we have developed a bit of a strategy because this is an initiative that I've been thinking for a while, and the first step in making it happen is increased collaboration. And I feel that this webinar with the participation of both Guy and Neil is a first important step toward that. We also want to make sure that our instructions for authors and templates are user-friendly. We recently revamped our instructions and also developed a template, which I'm going to show in the next slides, for case study submission from developing nations and other underserved settings. It's an optional template, but provides a bit more guidance that journals are used to provide just because we feel we want to encourage those submissions. We want to continue to have forum and events like the one we're just having one now. And we also wanted to make sure that we incorporate our readers' perspective within our sections. We have a section that is called Letters and Perspectives that you can learn more from our website that is about short pieces with opinions and experiences from our readers. We also want to do more issues, special issues on global topics that will bring together a lot of what I'm talking about. This is the template I was referring to, which is a very detailed template you can find on our website, and we're going to talk more about it in some dedicated webinars that we're planning to hold in the future. So what are some of the topics we're interested in expanding and hear from developing nations? On our last column, we have a number of health and social areas that we're interested in expanding. And I'm going to mention just a few of them. Definitely the field of health disparities and health equity. We know that vulnerable population across different settings share some common characteristics in terms of social discrimination, low socioeconomics, low access to products and services. And those characteristics and programs that address their needs, they can be transferred from one country setting to another. Obviously, the field of epidemics and emerging diseases, and I know Guy is going to speak about specifically risk communication in these settings, is a field of great interest to us. Chronic diseases is definitely one of the major epidemics recent years in a variety of different countries. And we also want to talk a bit more about mental and behavioral health, which is often a forgotten field and not integrated sufficiently in physical health and the food system and impact on nutrition practices on health and social accounts. On the right column, we have a number of areas in which we have an interest. Obviously, risk communication, we already mentioned, but also the patient and community engagement strategy, what is working, what is not working, integrated models for behavioral and social change communication. We really would like to see new outcome evaluation models, and obviously with interest also in special topics like cultural competence and gender communication. So these are some areas for publication or for research and program evaluation questions. So basically, what are some of the strategies for patient and community engagement that you have seen working in the field, or what kind of models for outcome measurement for patient and community engagement have you developed? What are some of the integrated planning framework and the results that you're using within multisectoral intervention? And in risk communication, how does risk communication is integrated in all of the different phases of outbreak control and response? What are some of the capacity building strategies? What are some of the determinants of behavioral and social impact? We know that there is always a lot of milestones to be achieved between communication and behavioral and social results. Are changes in awareness, are changes in engagement, are changes in knowledge determine the behavioral social results, or is the cultural competency of our interventions? And so on. So these are just some of the areas in which we're interested. We, for example, having a special section on digital health just and new media just in December, and that's another area that we're currently exploring. So what are some of the next steps from the journal perspective? We invite you to browse our instructions and new case study template and submit your papers for peer review. We have both instruction for manuscript preparation as well as the case study template that I just mentioned. Some of the upcoming webinars that we're planning on, one is a webinar specifically dedicated to providing technical assistance and discussion of our case study template. And the other one, we wanted to provide a forum for discussion of best practices in key steps in research monitoring and evaluation. Again, to encourage submission and to contribute to help building capacity and international understanding of different models among our readers and authors. So this is what I had to say, and for questions, these are our email, both myself and Radhika Ramesh, who's the journal's editorial assistant, and our website. And with that, I give it back to Adrian, and thank you for listening, and sorry for the late start of the webinar.
That's great. Thank you very much, Renata. And we've had a couple of questions, which reminds me to invite everybody this afternoon to, or this morning, to submit their questions. I'm going to wrap up some of the questions a little later. We'll finish the presentations at first. Renata just mentioned the editorial board, and I just wanted to say that we've got 3 members of the editorial board at least tuned in this afternoon. So Ros Daus from the Netherlands, Thanakorn Josevinja from the United States, and Maria Helena Bueno de Moraes Lopez. Apologies for my appalling pronunciation, from Brazil. Thank you very much for joining us. So Gaia, we'd like to come to you next if you're ready with your presentation, and we'll proceed to that.
Okay, hi, thank you very, very much. Can you see my presentation, everybody?
Yep, that's all great.
Okay, good. All right. So thank you very much for inviting not just me, but WHO, the World Health Organization, to participate in this very, very important initiative. As a practitioner, a communications practitioner, I really welcome this. It's something that's really needed, and I would like to spend the next 10 minutes just sharing a few thoughts about one of the areas that Renata introduced as an area where we hope to increase publications from Africa, Latin America, and Asia, and that's risk communication. When we talk about risk communication, we mean a lot of things, and we'll talk about that. But first of all, you know, the question behind the recommendation to focus on risk communication. So why do we need to increase publications in this particular area? Well, we've, as practitioners, known this for some time, but during the Ebola outbreak of West Africa, which started last year, there was a big knowledge gap that became evident. in this area of emergency risk communication, particularly in developing countries, in Africa, and in other developing countries. So we feel that research may be happening in these countries, but maybe not making it to the public domain in usable form. Why do we say that? Because we know as practitioners, we are not publishing ourselves. Our partners are not publishing. We're in this constant cycle of responding to one emergency, moving on to the next. We really feel very strongly that we need to capture the unique experience of practitioners in these countries and not just formal researchers. So obviously we want researchers to be engaged, but we also want practitioners to be able to publish. And the case study format that's been proposed here by Many Publishing is really, really important to that. We feel that there's a lack of capacity, sometimes lack of interest, knowledge, and incentives to publish, and making the process easier is an incentive. There's a big deficit of developing country experience in the global guidance. What do I mean by that? The World Health Organization is one of the few international organizations and one of the few in the United Nations that mandated to develop norms, standards, and legislation for global public health. And we do this based on evidence. Where does the evidence come from? It comes from research that is published. So without having access to this evidence through publications, we're not able to develop really strong guidance in which we can be confident that what we are proposing is in fact what is needed. So if I map what's going on in emergency risk communication, we have experience and research happening or taking place everywhere, but there are big research gaps that are not addressed. So WHO, working with partners such as Many, we want to address those research gaps. We want to encourage our own staff, our partners, and everybody else in these countries to publish both experience and research. And we want all of this to feed into the first ever WHO evidence-based guideline on emergency risk communication, which we've just launched the process, and we're in the process of looking for the evidence that's out there, with the ultimate objective that knowledge generation and codification happens and that this is shared in the field of emergency risk communication. So if I look a little bit at emergency risk communication, you'll see many people have different definitions of this, but I go back to the definition that has been developed under the International Health Regulations of 2005. So when there's a public health event, so an outbreak, a chemical spill, any other public health emergency, we see three strands. And I mention these so that people who are interested in codifying their experience or research through publication can think of these fields. So in the area of public information, through the preferred channels of the affected population, so media communication, social media, new media, telephony, all of that. Then what we call mass mobilization, the posters, the leaflets, the town criers, the handphone, the megaphones, the things that we do at a more granular level to get mobilized people. And then true community engagement of families, individuals, including through influencers. The output being that trusted information reaches people and rumors are addressed. The outcome being people take informed action to protect themselves and their loved ones. And the impact being reduced death, illness, and economic and social, extra L there, loss. So in fact, we are looking for evidence, research, publications in any of these areas. This has become really important for about 5 reasons that I want to go through quickly. The existing guidance that we have is not based on rigorous and systematic examination of evidence. This is a very important point for WHO. We're extremely uncomfortable asking people to follow handbooks and do things when we don't have the evidence. So we really want to promote the generation, the publication, and the sharing of this evidence so we can have a proper evidence-based guidance for governments to do emergency risk communication, but also to build capacity in their health systems to do this. As everybody knows, there's increasing threats to global health security, and there's complex issues, there's rapid migration, there's bioterrorism, there's lots of threats at the human-animal interface. So Ebola jump from animals to humans, MERS coronavirus from camels to humans. So there's a lot of research areas that come up as a result of this. The third reason is we need to, as Renata said, we need to look at areas that are related to recent transformation in communication technology. It's it's sad to know that more people have access to a mobile phone than they do to a clean toilet in today's world. But this also provides opportunities for us for communication. There's so the mobile phone telephone technologies penetrated almost universally. 6 out of 7 billion people on the planet have a mobile phone. Social media influence is enormous. And of course, we know there's declining trust in agencies, governments, and doctors and health experts because of this. The fourth reason is we need to tackle in sufficient depth how to factor in social sciences, economic, political, cultural, religious factors. And while, as Renata said, a lot of research that's happening from developing countries is not from the social sciences. So we really need to look at these, and some of the methods that we currently use are the anthropological studies, CAP surveys, knowledge, attitude, practice surveys, and there's a lot of other social science techniques which can be published and that can provide very, very valuable information for guidance. Of course, we need to focus sufficiently on not just the practice of risk communication, but how to strengthen national, local capacity. So health systems research. So these are 5 big evolutions, all of which have research and publication implications. So for WHO in this area, we ask 2 mega questions, and there could be lots of research questions under this. So the big questions are how best to practice risk communication in light of the challenges and the complexity of 21st century life. And the second question is how best to strengthen and sustain national and local capacity for effective risk communication. So some areas for publications that we're particularly interested in is trust-building techniques in different social contexts, different economic and different political contexts. Influencing perception. So we know fact may be one thing, but people perceive the threat as being very different, very serious or not serious at all. And we want research and publications on influencing perception. We want research on overcoming the barriers of traditional practices. So in Ebola, we learned the hard way that telling people not to touch dead people, not to practice traditional burials doesn't work. And so we need to do a lot more research and publications on this. Effective methods for social mobilization and community engagement. Again, Ebola completely challenged the way we do this. We did this in the past. The use of technology in emergency risk communication and measuring outcomes of emergency risk communication work. So we really are interested in not just the outputs, not the number of articles, not the number of news stories, but really, so what kind of outcomes happen as a result of the interventions we decide to implement. So these are some of the big ideas I wanted to share with you. I hope this is enough to stimulate a conversation. I really believe that a case study format and talking our constituencies and our partners through this would really help us to move this area forward. It is a step, but it's an important step in really encouraging research, sharing of experience, codification of knowledge and experience from developing countries, getting them published, getting that knowledge base stronger and sharing that better. So thank you very much again for including the World Health Organization in this. I really hope that together with the 90 people who are apparently on this webinar today, that we start a new phase in this journey. Thank you very much, Renata and everybody. Back to you, Adrian.
Gaia, thank you very much. That was great. And I know that there are going to be some questions because you raised so many important topics there. So I want to make sure we leave enough time for those. So I'm going to move straight on to our third speaker. I know that Neil Squires has got some really interesting things to tell us about as well. So I'm going to hand over without further ado to Neil.
Okay, thank you very much. And my perspective is really very much from a policymaker's perspective and trying to understand how sort of research can inform policy and practice. So I mean, I've worn various hats over the years. So the most recent one is working with the Faculty of Public Health, and we're very much committed to supporting the development of public health capacity in sort of partner countries, and that includes particularly sort of developing sort of public health research capacity. But with previous hats on, I've also worked for the Department for International Development and the European Commission, and both of those organisations are very much committed to building development capacity. Now, part of the reason for this is that there's an increasing recognition that health is a global issue, and health problems developing in other parts of the world, as Guy's story of Ebola has demonstrated, impact on the whole world rapidly. And the capacity to investigate and to understand the causes of those diseases within the countries where the diseases may originate is vitally important if we're going to be able to respond rapidly. So there's a very real reason for building up research capacity in all countries. It's enlightened self-interest, if you like. So the UK certainly is very much committed to this. Nigel Crisp, who's in the House of Lords and used to be the Chief Executive of sort of the National Health Service, has written on turning the world upside down, which recognises that actually another benefit of sort of promoting research and sort of development capacity in partner countries is that actually in the developed world we have much to learn from research that's done elsewhere. So this is very much a two-way process. So I mentioned some of the work that I'd done previously, and the Research and Evidence Division of the Department for International Development makes significant investments in sort of research globally. It has a budget of about 200 million per year, and a substantial proportion of that is funded through organisations like the Medical Research Councils, the Wellcome Trust, in order to build up sort of research capacity and facilitate research in many developing countries. And I've highlighted here one or two sort of links to sort of initiatives that have been funded, and just taking us to sort of one here on sort of the Royal Society and DFID building research capacity. Then it's possible to sort of see that the objectives of some of these initiatives are sort of very important. So I'm just trying to get back to the screen. Yeah, so the European Commission similarly has provided a lot of support through its external action programs to build capacity, research capacity in developing countries. So it's not just a question of publishing research. There is a recognition that we need to invest in research institutions and invest in researchers if we are going to get good quality research. So I think it's important to explore some of the funding sources that are available for building that public health research capacity, and to tap into those in order to make sure that the researchers have the resources and the technology in order to conduct essential research. Turning now back to the Faculty of Public Health and our commitments to building research capacity, we've recently produced a global strategy on global health. The first couple of objectives are about being better advocates for better health for all, and clearly that's underpinned by having solid evidence on what works. That evidence and that research needs to inform public health training and activities globally. But goals 3 and 4 are about supporting the development of public health workforce capacity, which includes the capacity of researchers. So we certainly are beginning to reach out to public health practitioners globally, trying to offer support to help them develop public health skills and competencies and research skills and competencies. And then through the journals of the faculty, we also want to help the process of sharing and disseminating knowledge and evidence that is being done. And that includes giving a better platform to researchers from all over the world. So one of the commitments that we made in our global health strategy was to work with the editors of the faculty's journals to ensure that they include global health priorities and publish research from low and middle income countries. to ensure that this information is made more available widely. And we also want to try to give a platform for those researchers in our annual conferences in order to build up the audience for that research. So a real commitment, I think, in the UK to learning from and supporting the development of research capacity in partner countries. But clearly, I mean, for research to be published, then the same quality standards need to be applied as they are for any publication of research. And there is a need to often support, maybe when people are publishing a language that isn't sort of their first language, writing sort of capacity and writing styles. And I think the journal has access to agencies which can support sort of new researchers who are sort of trying to get their first publication. But some of the criteria for selecting research articles of interest are that they must be of global interest, either because the subject matter is of interest or because the research techniques that are being used in order to investigate a particular initiative are innovative and could be applied elsewhere. And finally, really, I wanted to go on to try to illustrate this by giving an example of some research that's being done in partnership between sort of UK-based research institutions, so NICE International and the London School of Hygiene and Tropical Medicine, institutions in South Africa and institutions in Cuba. This particular piece of research is on the really quality and the relevance of the Cuban medical education system. Now, why is this subject of global interest? Well, Cuba trains huge numbers of doctors who are working in many countries throughout the world. About 460 went to work in West Africa to support the Ebola response, for example. There are currently 2,000 doctors or medical students being trained in Cuba to return to South Africa to support the health system. There are Cuban-trained doctors in the Gambia, in Zambia, throughout Africa, large numbers in Latin America. So clearly understanding whether that training is appropriate to and meets the needs of those other countries is important. And it's not only important for those countries who are receiving doctors, but there are a number of features of the approach that is used in Cuba, its orientation towards primary care, that may well be relevant for us in the UK as we struggle to meet our own primary care needs with ageing populations and yet a health service that tends to be dominated by curative care and hospital-based care rather than necessarily investing appropriately or sufficiently in prevention and health promotion. So these are big research questions where we have the influence not only to sort of shape policy in sort of resource poor environments, but where the research questions, if sort of well structured and sort of delivered, can potentially inform a policy in the UK and other sort of wealthier countries as well. So again, it's another aspect of enlightened self-interest. It's in our interests in the UK to support increased capacity development in partner countries in order to respond more effectively to global health challenges. And it's in our interest to support that capacity because there are many lessons in many of our partner countries that can help shape and inform and improve the quality of our own services. So those are my main messages, that really investing in sort of building research capacity is vitally important. And that's all from me.
Thank you so much, and thank you to all our presenters there for some very different and fascinating perspectives on this. And because I don't want to waste time, I want to put a question to each of our presenters and then throw the discussion wider. I'm going to start with Neil. We've had a question from Prabhu, who I think is in the Netherlands, who says, has there been an investigation on identifying research themes which have the potential of a win-win between developing countries and developed countries and vice versa? Could you comment on that, Neil?
Well, I think a number of the assessment processes for sort of research that certainly DFID and the European Commission conducts are intended to identify, yes, who will benefit from the research, what are the policy implications, and sort of trying to ensure that in investing in building capacity, particularly if it's a partnership between an institution in the UK and, say, an institution in Africa, that the institutions that are being supported develop, and everybody benefits, both in terms of the sort of recognition that comes from publication. So there's a win to the partner organisation, but there's a win in terms of increased sort of understanding through sort of high quality research, which has global implications. So there can be a win-win in that sense, if that answers the question.
Right, thank you, Neil, and I'll give an opportunity for others to come in on that. But I just wanted to address a question to Gaia. Emmanuel from Nigeria, thank you, Emmanuel, has asked, he says, in Africa, it's remarkably difficult to get research findings into the public domain, largely due to two factors. Firstly, mainstream media have little or no interest in this aspect. They're more interested in what sells papers quickly. And secondly, scientific journals don't routinely give out press releases or press conferences to the public on important published papers. Any suggestions, Gaia, on how this can be addressed?
Thank you, Adrian, and thank you, Emmanuel, for that question. Yes, these are big realities, and particularly in Africa. I mean, we know of instances where we actually have to pay journalists, or people have to pay journalists to have press releases and media releases published. But I think that's why this particular initiative of understanding a simple methodology, the case study methodology, and working with journals such as the journal that we're working with now is quite important. And the World Health Organization is quite happy to support some of that. I think we have to start where it's easy, and I think the case study format is very good. I think we're working with many publishing, that's very good. What we need to do is to encourage other journals to start thinking of ways of getting the research published. What we are doing within WHO is we are asking our colleagues and partners to partner with researchers on the ground. And we're trying to put practitioners and researchers together, because researchers have the tools and the skills to write up research in a way it will be accepted. We also encourage, whenever we're involved, to have open access publishing, so that the benefits of this knowledge can be shared everywhere. So these are some of the initial thoughts I have, Emmanuel. I obviously don't have a full answer, but I believe this is a start. Over.
Thank you very much, Gaia. Emmanuel also asked a question which I want to ask Renata perhaps to comment on. Emmanuel says that Renata mentioned capacity building events as one of the strategies to how the journal can help. But he's saying, what is the platform for deploying those strategies? For example, are we going to be partnering with institutions, organizations, individuals in developing countries? And he asked this because for several years, as a group of journal editors, he and his colleagues have tried to build research and publishing capacity in Nigeria, but it's been quite difficult to find support both locally and internationally. Renata, could you comment on that?
Yes, I think capacity building is very important. So from our own side in the journal, as you have seen, we already have been planning some e-workshops that will help not only potential authors to become familiar with our case study template, but also to become acquainted with best practices in research, monitoring, and evaluation. The idea of collaboration is on our mind, and we obviously want also to partner with local institutions and invite presenters from this local institution to share their perspectives so that this dialogue can continue. I understand that there are a number of difficulties, and these difficulties are due to conflicting priorities, limited funding and other things like that. But if we continue to debate and create a sustainable capacity on these different issues together, I think that many of these issues may be resolved with time.
Thank you.
Adrian, can I just add something on the capacity building? Is that okay? This is
yes,
Gaia.
it is. Who's that?
This is Gaia.
Oh, Gaia. Hi, Gaia. Yes, please go.
Yeah, just a quick note. In Africa and in the Eastern Mediterranean region, we are partnering with the World Federation of Science Journalists to build the capacity of local media to actually to be able to understand, to interact better with researchers, and to look at publications as a source of information for media work. So I just wanted to add that there's a longer-term project to engage with science journalists to be able to give them the skills to cover this in Africa. Over.
Great. Thank you very much, Gaia, for that. I just wanted to come back to a question from Prabhu, who is asking why developing countries are not publishing in health science journals. He's suggesting that that's not completely clear. Has it been investigated? And really asks a broader question about the level of interest in publishing, the kind of potential and capabilities of publishing, and motivation. And I want to come back to that question of motivation at the end. But Renata or Neil or Gaia, is there something that you might like to say about those first ones?
This is Renata. I want just to see that the question of motivation is very important. In developing nations, there are so many conflicting priorities and crises. So I think that I would like to basically highlight also the role of the media in creating a sort of push-pull dynamics so that institutions, governments, and policymakers understand the importance of sharing this information. The major issues and the major obstacles for fairness, I think, yes, it is motivation, and we need to create more awareness of the importance of these experiences for the global community. But as some of the participants have also mentioned, it's also how do we create a steady research funds and monitoring evaluation funds for for communication or for other global health areas. And I think that's one of the main issues. If you do look at communication alone, some data that came from the University of Toronto not many years ago says that only 30% to 40% of all health communication interventions are ever evaluated. And lack of funding is often a very big motivating factors for this. That's why, continuing to showcase the importance of this and creating alliance and collaborations may be the path ahead to resolve some of these issues that go also behind motivation. Over.
Thank you.
If I can come in there as well, it's
yes,
Neil here.
Neil.
Yeah. I mean, if we look at the incentives that are in wealthy countries for publication, I mean, then universities' reputation is based upon their publication, and payments to universities, in fact, increased with the higher publication ratings. But in many resource-poor countries, I mean, there isn't that financial investment in response to publication. So, really, the main measure of success is whether the research is policy relevant, and then it's the incentive to researchers is to produce something that is beginning to help shape the health system in their country or influence policymakers. So we need really to have measures of success and incentives which recognize good policy relevant research, because a lot of research doesn't actually translate into policy and practice, and we need to start recognizing the value of policy that is based upon policy priorities identified jointly with some of the key stakeholders, so with government or health services who are really struggling to find issues to particular health challenges. And that maybe is the way of creating incentives, like working jointly with policymakers to identify what the research priorities are.
Neil, that's great, thank you. We have a little under 10 minutes, so please do continue to send in your questions via the webcam. I've just got one more that I want to put to the panel before we throw it open further from Laura from CDC in the United States. Thank you. And Laura asks if there are any best practices on how to get quick IRB approvals in developing country and potentially several home countries of authors, researchers when doing emergency risk communications research, where time is of the essence. Any comments on that from our panelists? Or indeed from anyone else?
I mean, if I can, while people are thinking, maybe I start off. I think linking to both of the questions, the previous one and this one of the other problems that we see is that within practitioners, I'm not talking about researchers, practitioners, there is no culture of research or publication. So it's a real big problem to change that mindset. Second, I think there is discrimination, if you like, against social science research as opposed to other types of research, particularly in health fields. And I've felt this through the World Health Organization quite strongly. So I think there are many cultural, soft issues as well as the policy and the structural issues that prevent us from having the sufficient quantity and quality of research from developing countries. But capacity building goes well beyond, training people how to write or how to publish. So I think one of the things that we all have to do is to try and change the culture and make it easy and give the incentive for people with knowledge generated through designed research or through experience to be able to present that in a way that is easily publishable. Now, regarding approval within our own organization, the approval processes are being expedited, but I'm not really well versed to answer about national processes. Over.
Thank you, Gaia. And unless somebody else has something to add to that, I want to throw in a question from Janice Longstreth sorry, I had it a minute ago, from the US somewhere. Oh, no, from Canada. Sorry, Janice. And Janice is asking if there is also an issue with writing up research in a manner which is acceptable to a traditional journal. And this, I think, brings us back to the practicalities of submitting manuscripts. So if others would like to come in on this, please feel free to do so. So any comments from our panelists on that? I mean, Renata, perhaps, would you like to have a go at answering that one?
Right. I think that all peer-reviewed journals, they need to oblige to certain standards. But I think that one thing that our journal has been trying to do is to avoid that basically our standards includes the use of jargon or specific heading and subheading. Clarity of the experience is very important because that also encourages authors to present experiences in their own voice. On the other hand, the standard of publication they need to be unified across different countries, across different experiences so that people can really take advantage of results and so on. And this brings back to some of the previous question on best practices. Although I'm not familiar with any specific literature that has been produced on best practices, different aspects of basically submitting and getting your article produced or encouraging publication from any underserved settings have to do with some of the things that have been mentioned, but they would be great to have them all one after another. How do we create a culture of publication in organization, which means how do we build capacity? How do we make sure that we create collaboration for increasing funding? How do we make sure that journalists can actually create this full push dynamic? And all of these increases the motivation of people to publish and also their ability to comply with standards of publications. I know that sometimes it's perceived as an obstacle, but from a journal perspective, we need to preserve the peer review process and the rigorousness of all of the information we publish. Over to Adrian.
Thank you, Renata. And perhaps you could just help me out on a question that both Emmanuel and Maria have asked about whether the slides will be available after today's webinar. I'm guessing yes?
Yes, the entire webinar is being recorded and will be available on a variety of different links, both on the journal webpage, on the YouTube channel of Money Publishing, and other links that will be identified also along with our co-presenters.
That's great, thank you. So we have about 3 or 4 minutes left, so it's an opportunity for others to come in and ask any questions now. And are there any barriers to publication that we haven't yet talked about that people would like to mention? And one thing that I was thinking about was whether all of our participants today have any views on whether they think that it is better to publish perhaps in regional journals, perhaps in a relatively low impact publication where perhaps there might be a greater political influence, or to do that rather than to choose a potentially higher impact publication internationally. I wonder if any of our participants out there have any views on that.
This is Renata, but I would like really the other 2 presenters to comment on this if possible. And I feel that it really depends on the issue. If the issue is primarily of local relevance and you have a very important publication that is local, is native language, that can help push that issue at the policymaker level, obviously that would be your choice. If this is a global international issue or an issue that the global community can help with, because especially the translational research in policy and practice is sometimes also subject to the influence of the broader global health community, so your choice probably will be a global publication or a publication of a global reach. So it really is issue specific in my mind. Over.
Thank you, Renata. And I'm pleased to say that Leslie Pritikin from Italy has come in right at the end. Leslie is a scientific editor, and I'm just going to read the question here. Why are there not more formal courses on how to structure a scientific paper according to what editors and reviewers will be looking for? And wonders whether we're putting the cart before the horse here. Before we talk about areas for publishing, do we need to focus on the competence in writing a scientific paper?
I agree that that's very much important. One of the things we did at a recent faculty conference is ran workshop sessions on sort of good writing for our own journal. But it makes sense for journals that are wanting to widen their audience and sort of widen the number of contributors to offer courses or instructions on clear writing for the journal. And I think that does need to improve.
Neil, thank you. And if I can just say, Leslie, that I spoke with one of my colleagues in the Medical Research Council. He called me from his hotel room in Africa, where he's doing a training course precisely on writing for academic research journals. And he made the point that, as you're making actually in the end of your question here, that writing and publishing is, yes, it's part of what scientists and researchers have to do, but it's also an important skill in developing interdependence with other colleagues from a whole range of different organizations in the media and so on and so forth, and that this is should be a really important part of the career path as well. I think that's a slight extension of the point you were making, but thank you very much, Leslie, for raising that. Now we've just gone over the 5 o'clock mark, and we've just got a couple more, or just one comment, I think, from Emmanuel, just to finish us off. And he says, in Nigeria, some universities require their staff to publish in high-impact journals just to get promoted. For this reason, many would rather publish in a high-income country journal where the paper has little or no impact, rather than publish in local regional journal where the paper may have more relevance. Emmanuel, thank you for answering that question that I posed a few minutes ago there. And I think with that, I'm going to hand over to Renata, just perhaps for a final word.
Yes, I just want to thank you, everyone, for the participation, and I wonder if anyone of our speakers has closing remarks before giving it back to you, Adrian, for your own closing remarks.
Hi, Renata and Adrian. Thank you. This is Gaia. Just to thank everybody for their participation. This is an area which is new for us as well. And I hope to learn together with all of you. And hope to see you in future webinars. Over.
Thank you, Gaia. And Neil, thank you very much indeed to you. Is there anything else you'd like to sign off with?
No, just to highlight the importance of sort of getting the research into policy and practice, and from my perspective, publishing it where policymakers are going to read it is the most important thing. But I recognise the requirements to try to get it as a high impact as possible. But for me, policy is and policy change is the biggest difference we're trying to achieve.
Excellent, thank you. And Renata, is there anything else that you'd like to say before we wind up?
I want to thank everyone for their participation and our very outstanding speakers and for being part of this initiative. We hope you will be exploring the tools we have mentioned, and we agree with Neil that the most important things that research should generate is impact on policy and practice, as well as new models for our interventions in different countries. And we invite you to explore our resources and hope that you will be participating in our follow-up webinars. Thank you, everyone. Thank you, Adrian. Thank you, Neil. Thank you, Gaia. And thank you, all participants, for your questions.
Well, I couldn't have said it better, so I won't say it. So thank you to everybody. Thank you, Safide, for your comments. Thank you for your questions, for your thoughts. Thank you, the panelists who've raised an awful lot of issues, really important points here, and it's clear to me, and I'm sure many others, that this is a journey that we can travel along together and really get to grips with some of these really important issues. So thank you very much indeed, everybody, for taking part today.